Experience Registry. The Cancer Experience Registry is an online research study with the goal of improving support services, enhancing cancer care, and influencing health policies for all people affected by cancer. And we are here today to help you understand the importance of the registry. I am joined today by two lovely panelists, Dr. Melissa Miller and Dr. Stuart Goldberg, who will each introduce themselves, and we will then bring some conversation to help understand more about this registry and how you can join the study. And following our conversation, you will have the opportunity to submit your questions to Drs. Miller and Goldberg via the Q&A found at the bottom of the menu bar. Dr. Miller, would you like to introduce yourself?
Sure, thanks, Audrey. I'm Missy Miller. I'm Senior Director of Research at Cancer Support Community, and I have a PhD in International Health. I did my postdoc at the Office of Cancer Survivorship, which is where 15 years ago, I was connected with Cancer Support Community and the work that they do. So I have been around CSC for many years, supporting the research and work that we do, and it has been a privilege to see the organization grow, as well as the research that we do at CSC grow. And so I'm really happy to be here today to share with you about the Cancer Experience Registry. I'm also going to add that it is my oldest daughter's 16th birthday today, and I'm going to be hosting Donut Olympics tonight. So I like to give a little personality to with who I am, but I also just really want to welcome you and thank you for taking the time to hear what we have to say today and share with you. Dr. Goldberg.
Thank you for inviting us. I'm Stuart Goldberg. I'm a hematologist. I take care of patients with MDS at the John Thorpe Cancer Center in Northern New Jersey. We are one of the MDS Center's Foundation's Centers of Excellence. This is a program of hospitals that across the country that specialize in the care of MDS, and been happy to do that for more than 20 years now. It's a pleasure actually for us to partner with the Cancer Support Community on this important registry to show how we can help elevate some of the emotional and psychological side of cancer care for patients with MDS.
Thank you, Drs. Miller and Goldberg. Dr. Miller, can you tell us who is Cancer Support Community?
Sure. So Cancer Support Community is the largest professionally led nonprofit network of cancer support worldwide that delivers free support and navigation. Thanks, Madison. That delivers, yep, there we go. Free support and navigation services to both patients and their families. And CSC's mission, as stated here, is to ensure that all people impacted by cancer, patients and caregivers, are empowered by knowledge, strengthened by action, and sustained by community. And CSC achieves this mission through three distinct yet interconnected pillars. You can see them here in the circles shown on the right. CSC achieves this mission through direct services and care delivered directly to patients and their caregivers, through research, including patients and caregivers, and through advocacy and policy. And at the center of this, we keep the cancer patient and their caregiver. So the first is through direct service delivery through our brick and mortar facilities that are across the United States and Canada and some international. And social workers and licensed mental health professionals provide high quality social and emotional supportive care. You might ask, and I know because others have asked me, what is supportive care? And so I think the best way to demonstrate what supportive care is through some examples of the types of programs that our network partners deliver. They can include support groups, virtual or in person. They include health behavior and lifestyle programs, nutrition classes, art workshops and programs like music therapy, painting, journal writing, and creative writing. They include physical activity programs and through yoga, Tai Chi, and other exercise programs, as well as meditation and mindfulness. There's education programs on a variety of topics, including things like sleep, advanced care planning, chemo brain, health insurance, and even humor. If there isn't a local community near you, CSC also has a community of support available online and over the phone through our hotline or through our helpline. And so you can see that there's a wide range of services that are free to patients and their families. The second area includes patient advocacy through Cancer Support Community's Cancer Policy Institute. And their mission is to inform public policy in Washington, D.C. and across the nation. And then lastly, in the third pillar, is where I sit and my colleagues here on the call. And this is where CSC carries out its mission through research at the Research and Training Institute. And this includes PhD and master's level researchers who conduct research into the patient and caregiver experience through doing psychosocial, behavioral, and survivorship research.
Thank you, Dr. Miller. Dr. Goldberg, you have seen a lot of patients from all walks of life. How do you see organizations like the Cancer Support Community playing a role in their care?
Well, obviously, I would hope that the doctors and nurses at the hospitals where patients are getting care have done a very good job of teaching you about the disease and about the treatments and the complications of the therapy. But I will tell you that at many centers, including my own, we don't do a great job of talking to our patients about some of the psychosocial problems. How is it affecting them emotionally? How is it affecting them financially? These are things that often fall to the side as we spend those few minutes that we have with our patients, more focusing on the medical and the chemotherapy and the treatments. And so organizations like the Cancer Support Community, the MDS Foundation, American Cancer Society, these other support groups, they provide an important role to fill in those gaps, to really help our patients understand some of the other things that we've done a bad job of reaching out to our patients. And hopefully we can learn lessons from things like the registry that are run by this that will then help us do our job better when you come to the clinic to see patients. So it should be a loop, but I think that this is the start to getting that loop, finished. You have to start somewhere, and having organizations like this that provide that support are very, very important to look at the whole picture.
Thank you, Dr. Goldberg. Dr. Miller, how does research contribute to the Cancer Support Community mission?
Yeah, I'm going to start by quoting our board chair, Lauren Barnes, because I think she said it so well and succinctly. And so in her words, she says, "We use information from patients and caregivers to give us real life data about what their experiences are. We then use that data to publish and to share it with congressmen, with doctors, with researchers, anyone who can help us make laws or make changes that improve the lives of cancer patients." I think this also shows that at the highest level, CSC is committed to research and carrying out its mission. When patient and caregiver insights are collected systematically through research, like we do at CSC, so systematically and methodically through the research mechanisms that we use, this is a great opportunity. And first, it gives patients, survivors, and caregivers a platform to share their voice, share their experience, share what they've gone through, their insights, and use that to harness and power to affect change. And then second, when patient and caregiver insights are collected systematically and methodically through research, it gives us, it gives CSC, it gives researchers, it gives doctors like Dr. Goldberg, powerful data and a mechanism to be able to communicate and advocate on behalf of all those impacted by cancer. And so at Cancer Support Community, our flagship research initiative, and actually our longest running initiative, is the Cancer Experience Registry. And that's what we're here to talk about today. And the registry is an online research survey that aims to understand not only the physical, but the emotional, as Dr. Goldberg alluded to, the emotional, the physical, the practical, the financial impact of cancer, and use that investigation to identify met as well as unmet needs and where the system has failed or where there's gaps in care and where patients are left with critical and persistent needs. And then that we are able then to collect that information and to then try to fill in those gaps. And so for more than 10 years, registry data has been used to influence healthcare policy at the state and national level, improve support programs in local communities, and enhance care. In the Cancer Experience Registry can help fulfill CSC's mission than to hear from a participant. And so we're going to share a video with you from Paul. And Paul joined the Cancer Experience Registry and share his experience with us.
proud to be a 3-time cancer fighter and winner. I was first diagnosed with prostate cancer in 2007. I was the 46th person in Colorado to have focal cryosurgery, and it came back in 2017. After the return of the prostate cancer, we noticed a lesion on my right kidney, and that ended up being cancerous. I had a cancer in 2020, and I was left with no option but radiation treatments. We won't know for up to a year if we got it all, but at a minimum, I feel like we gave it a bad sunburn. The Cancer Experience Registries, their surveys go below the clinical data. They broaden the experience and they get to the emotional and mental and spiritual aspects of dealing with cancer, and that's huge. You know, they're not stopping. They're just going deeper and broader all the time, which is immensely helpful for those who are fighting the fight. It does help with all of those decisions. That I trust it. I get follow-up surveys, which is immensely helpful. The Cancer Experience Registry does use that data to influence policy decisions, to influence funding as they expand their services. Having a trusted source of that rather than just anecdotal data, it is very secure and also very trusting. In order to get deeper, you need that level of trust and a feeling of security that my data is protected, and I have that feeling. I love volunteering at Food Bank because the activity level is high, and I also can see the fruits of my labor. I know that I'm making a difference when I volunteer here. I've been a volunteer at Food Bank of the Rockies for a little over 23 years. I do it because I believe in paying it forward. People have done lots for me over the years. There's always been a support system there for me when I needed it, and these are folks who need it and don't necessarily even ask for it. Giving your time, that's irreplaceable. I believe in paying it forward.
That was so well said from Paul. It's so important to have multidisciplinary care in the cancer care trajectory. Dr. Goldberg, we hear a lot about clinical research to advance cancer care and develop new treatments, but what is psychosocial research and why is it so important?
Well, I mean, you hear a lot about clinical trials, and these are the things that patients want to get into. They want to get the newest drug, the newest therapies, but we often, as I said before, don't really focus on some of the other issues that are important to our patients, such as how much does it cost to be a patient with MDS? And when we want to get support, from our government, from our hospitals, when I go to the hospital administrators and say, hey, I need another social worker, they say the expression, show me the money, show me the data that you need this. And so by doing well done clinical research on the psychosocial aspects, on how much does it cost, what are the emotional impacts, I can use that information, if it's hard numbers, to go back to the hospital administrators and say, see, I need a social worker. And I can give that data to the policymakers, to ASH and ASCO, the big organizations that have lobbyists that go to Washington and say, hey, we need support for these things. And that money and those policies are only generated when you show them the money, when you show them the actual data. They don't say, well, patients need therapy or they need emotional support. That doesn't mean anything. But if you say 40% of patients, are patients with cancer who have MDS, say that they're financially strapped, or 20% of them are saying that they are dipping into their savings, then, and I can say it actually is 20%. It's not 30 or 40 or 50. I can show them the numbers. And how do I get those numbers? I get them from the MDS Foundation's support with the Cancer Support Communities Registry, because those are the actual numbers that we're going to present this year at a national meeting from this registry. So by knowing it's 20% of patients with MDS are dipping into their savings or borrowing money to care for them, I can use that data to go to a policymaker and say, this is the actual cost. And that is very important because that's how you get changes done. Not by saying, oh, it's a lot of people, like giving actual numbers.
Thank you, Dr. Goldberg. Dr. Miller, can you explain in more detail what the Cancer Experience Registry is and why it was started?
Sure. So in 2010, the registry has a long history. I'm going to walk you through a brief historical timeline. I think that sets the stage for where we've been and where we are today. But in 2010, the National Philanthropic Trust of Jenkintown, Pennsylvania, awarded CSC a grant to establish a new national breast cancer registry. The goal was to connect those diagnosed with breast cancer across the country and to use the findings to provide strategies and recommendations for seamless delivery of supportive care throughout the course of treatment and into survivorship for breast cancer patients. And thus began Cancer Support Community's work to build a Cancer Experience Registry. This inaugural project was fondly known as the Breast Cancer MAP Project. MAP stands MAP, Mind Affects Physical. And this served as a cornerstone in building CSC's research capacity, as well as served to foster public awareness of the unique research that we do at Cancer Support Community. We quickly learned how valuable this research was, and Dr. Goldberg just gave you a great idea of how valuable this research can be. But gathering patient insights, we learned how important this work was. And so in 2013, the registry was expanded and opened up to anyone diagnosed with any cancer. So it was, and then in 2000, so that was in 2013, and in 2015, we also opened it up to caregivers. So any caregiver who had provided care for someone with a cancer diagnosis as well, of any type of cancer. And over the years, the survey questions themselves have been updated to keep up with the latest developments in oncology. And one thing that I think is really unique is how we've developed the survey. And that's that the researchers themselves didn't just come up with the questions. We've actually worked really closely with clinicians and advocacy organizations like those here, with social workers, with patients and caregiver themselves to develop questions that are focused on a wide variety of topics that really matter. And so over the past decade, CSC has also launched what we call our specialty registries. And we've launched, you see those listed here, 14 different ones, starting with multiple myeloma, CML, lung, and melanoma, just to name a few. And what we mean by that is we've added some additional questions tailored to specific cancer diagnoses. And then we launch additional outreach efforts into those communities. So today we get to hallmark that exactly 1 year, almost 1 year ago today, CSC in partnership with MDS Foundation launched the MDS Specialty Registry. And to do this, CSC and MDS Foundation convened a group of experts, including Dr. Goldberg, MDS Foundation, patients and caregivers, and other subject matter experts. And we created some additional tailored questions for the MDS Specialty Registry. And we began outreach into MDS to reach MDS cancer patients and caregivers. And so that's just a little bit of the history of the registry. So what is it today and how is it keeping pace? It's interesting to note, and I think it's fascinating to follow the history, but when this registry was first launched, there were about 12 million cancer survivors in the United States. Today, there are 18 million. We also continue, and part of this is because of the advances in cancer therapy and treatments. And so we continue to see cancer therapies advancing at a rapid rate, leading to many more treatment options that also make navigating cancer care increasingly complex for patients and caregivers. On top of that, there's been a global pandemic that's caused unusual delays in not only care, but in diagnosis, and it's also intensified emotional distress. So research into the patient and caregiver experience must keep pace with these innovations in care and changes to clinical care and the evolving landscape. So we've added a few enhancements to the registry. I think the easiest way to illustrate this is to walk you through what it's like for a participant who joins the registry. First, anyone an interested participant, and so the registry is open to anyone diagnosed with cancer, anyone who's provided care to someone with cancer, those that are 18 years of age. We're limited to adults living in the US and Canada. Okay, so go to the next slide. So first, an interested participant goes to our website at cancersupportcommunity.org/registry. From there, they click on a button that says they'd like to start the survey. They can sign up either as a patient or a caregiver, and that launches the individual unique surveys for both patients and caregivers. and they start answering their survey questions right then and there. Keep in mind the survey is completely confidential. You can do it on your computer, a tablet, smartphone, and the survey takes about 35 minutes to complete. You don't have to do it all at once. So you can start and stop the survey whenever you like, because we email each participant their own personal link to get back into the survey. We've worked really hard to make this as easy as possible for patients and caregivers to do, and we appreciate each and every person who takes the time to come to the registry to answer these questions and to share and document their experience and their insights. There's also another thing we've added, and at the end of the survey, patients are given the opportunity to nominate their caregiver or caregivers to take part in our caregiver registry. Similarly, caregivers can nominate the patient they're caring for or have cared for. And this way we can pair patients and caregivers so we can better understand the cancer experience through the entire family unit, if you will. We also can learn how caregiver experience impacts patient outcomes and use that data to be able to advocate on behalf of both. The completion of this first survey launches each participant's own timeline. So in 6 months from completion, the participant will receive an email to complete the first of a series of 4 follow-up surveys. This is a new feature of the registry, and it allows us to follow participants over time. So the follow-up surveys come every 6 months for 2 years. Of course, these are completely voluntary. In addition, participants may be invited to take part in what we call spotlight surveys. And these are shorter 15-minute surveys that go deeper into emerging topics in cancer care. We recently ran the first spotlight survey, and that was on barriers to accessing care for emotional or mental health concerns. It included questions around personal barriers, like there's nothing that can be done, or I want to take care of it myself, plus barriers related to cost or wait times, or even previous bad experience with other mental health professionals or COVID-related concerns. The dollar signs shown here on this figure also represent that participants can receive gift cards for completing these follow-up surveys and spotlight-focused surveys.
Thank you, Dr. Miller. Dr. Goldberg, do you have anything to add? Any additional thoughts?
I think that this survey is designed to be easy. I mean, I helped with some of the MDS questions, and this is not a quiz. We're not trying to, we want to know what you're feeling, what you're experiencing, and so it's made to be friendly and it's made to be easy to do. I think that's important because we know that a lot of MDS patients are a little older. They may have difficulties in doing some of these online things, but this is not a typical, not a difficult thing. It's not a quiz. We want to learn what you're feeling.
Thank you, Dr. Goldberg. Dr. Miller, what are some of the topics that the survey covers?
Yeah, and actually, before we launch into that, I do want to take an opportunity to show another video of a participant who took part in the registry. And I think through her words, you can get an idea of what it was like and her feelings of trust in doing that, and the confidentiality provided, and kind of to what Dr. Goldberg says, it's really not a quiz. It's about you. You have the right answers. How about that? You have the right answers to these questions. And so let's hear from Nikki. She's a breast cancer survivor, and hear what she has to say.
There you go, Damon. Good job.
Yep. Do we have the life jackets?
Yep.
I discovered a lump in my right armpit and made an appointment with my primary care physician, to which we discovered it was just a cyst, but made an appointment for a mammogram anyway. And indeed, it came back as a stage 1 invasive ductal carcinoma. It was very aggressive, and we needed to move quickly. We knew that the best course of action would be bilateral mastectomy. I came across the Cancer Experience Registry in my countless hours of researching on how I could give back and how I could contribute to the cancer community. They gave me an opportunity to tell my story and to give them information so that I can contribute to the research. They advocate for caregivers and for patients to make change at the very top level with legislation, laws, and just overall human rights. The word experience is key here. This cancer registry is the whole experience, from being a previvor, right, and knowing that you may have a potential mutation, all the way to the financial implications to surviving in remission. It's the entire experience all wrapped into one. And I love knowing that I'm part of their database, so that if there's something coming up that is a niche thing that I qualify for, that I can help somebody in the future, like, that is so gratifying to me. You can do it, buddy. Hi, guys. Have a seat, babe. Oh, yeah. It is so easy to use their platform. You can use your smartphone, tablet, computer to log on to their website. It feels safe, it feels authentic, and I feel that they are using my story for the greater good. What does this say? Be brave. During the pandemic, there wasn't a whole lot to do. So trying to get my strength back, I went on a walk with my kids and started to write inspirational messages on the sidewalk. Started with, "You are stronger than you know." Once I made it through the cancer experience, I started to notice nature more, and the beauty and the changes that come with the seasons. It has really been a big part of my healing process. So the cancer's gone, but the life lessons remain. And so it's important to remind others, cancer or no cancer, that they are stronger than they know.
What an inspiring video. Dr. Miller, how are registry findings used to improve the lives of patients, survivors, and caregivers?
Yeah, thanks, Audrey. So I'm going to first walk you through some of the things that we ask about and the types of information, and you've been hearing a little bit along the way of the types of data that we collect. But this slide here shows you what kinds of things are in the survey itself. And in Nikki's words, it's the whole picture, right? We try to capture the whole picture, not just, you know, the physical, but we really try to dive deep and cover a broad array of topics. And so listed here, you can see the blue box highlights that we have a caregiver registry and asks questions about caregiver health-related quality of life, as well as preparedness, as well as some of their unmet needs and what kinds of support they want for themselves, as well as what kinds of support they want in order to be able to care better for the patient. And then the patient registry here in the red box shows some of the different things we ask about. We start with asking some background information with demographic information and clinical history, as well as treatment history. And that's really important for us to be able to characterize our sample. We need to know who comes into the registry so that when we do share data back with clinicians, with policymakers, we don't make the incorrect global interpretation of our findings, but we know exactly who is represented and whose voice is there. It also allows us to identify inequities or disparities in care across different groups. We also capture information on what we call health-related quality of life. And that is a big word for a lot of different aspects that capture emotional, psychological, social functioning, financial well-being, many different aspects of quality of life. We ask about treatment decision-making, shared decision-making with caregivers, as well as types of shared decision-making with your healthcare provider. We ask about quality of care, satisfaction with how your healthcare provider has engaged with you. Do you feel comfortable sharing about symptoms and side effects with your provider? What has that experience been like? As well as access to care and barriers to care. We have some questions about genomic testing and genetic risk testing and how that might have been used to inform your care plan or not. And then we ask some things about health behaviors, physical activity. And so there's a lot of questions that are broad. And then just to complete the slide out, the salmon colored box on the far right indicates the 14 specialty registries, MDS being one, where we have some additional tailored questions for those diagnoses. And so then So how do we use this information to impact the lives of patients and caregivers once we get this data from this survey? And so we've been alluding to this along the way, and I like to link it back to the 3 pillars at CSC. You know, I feel pretty privileged as a researcher. You know, I came out of the academic model and now work for a nonprofit advocacy organization. So as an academic, we do like to share our findings back with scientific audiences. And we just learned last night that our hot off the press MDS research findings were accepted at ASH, as Dr. Goldberg mentioned, and we'll be presenting at what's the American Society of Hematology, where hematologists will be there. Industry partners will be there. Other scientists will be there. And we share that information, that scientific information out. And so we're excited to be able to share those findings in December. But at CSC, we also sit uniquely poised between a policy institute and our network partners who deliver free care. So we share data with our policy team, and they're prepared and trained to take those findings and go and advocate at local, state, and federal levels for change to healthcare policy. And then the direct services branch through our network partners. We have update calls with our network partners where we share research findings and we relate back to them how those findings can impact or strengthen the programs that they deliver. Maybe they can identify new programs that need to be created based on what we see as unmet needs and gaps. We also share back with our network partners across the US what we call our community needs assessment that really is derived from data that's collected in the registry. So we can share back directly with those who are delivering care. We also have award-winning educational materials called Frankly Speaking About Cancer. And we very frequently share data with our colleagues who develop those materials so that we can provide educational materials to improve and increase understanding on topics where we see gaps. And then we're also able to share with advocacy organizations like MDS Foundation, who can then take the data and use it as well to develop real solutions. Lastly, we have what we call a participant newsletter. And this is where we get to share back with participants. This is an example of what we send out. We have a quarterly newsletter. And this is where participants in the registry can read about research findings as we learn them. And we also take the opportunity to connect them to valuable resources. So you can really see that when we collect data in this registry, it doesn't just get filed away in a cabinet somewhere. It doesn't even just live in the scientific audience space. It gets used to impact real change for real people impacted by cancer.
Thank you, Dr. Miller. Dr. Goldberg, do you have anything to add on how the registry data is used to improve the lives of patients, survivors, and caregivers?
I think that Dr. Miller summarized it really well, that this data, does get used. And I think that's the key, that, it's seen by the patients and by the people who participate. It's seen by the hospitals. It's seen by, the MDS Foundation, so that we can, use it and spread it to our members as well as, to national organizations. So I think that the key here is that it's used across the board.
Thank you, Dr. Goldberg. Dr. Miller, how can we learn more on how to participate?
Yeah, and it's easy. And we'll put a link in the chat for you. You go to cancersupportcommunity.org/registry. And once you click on that link, you'll see a place where you can start the survey. You'll also see some more information about the registry, and you'll see the videos we've shared with you. So if you'd like to share those out, share the link out, share the information with those in your network and those that you know, that's where you can find that information. But you go to the website, click the link, and it'll start, and that's where you get to start the survey. The first thing you'll see is a consent form. The Cancer Experience Registry is an IRB approved research study. And so if you agree to participate, you can provide your consent and get started right from there.
Thank you, Dr. Miller. We'd like to take this time to share another video of a Cancer Experience Registry participant. Her name is Lynn.
I'm going for my walk today. It's nice before it goes to 99 degrees. I was a caregiver, and After that, I became a cancer patient. I took good care of both of my parents for 10 years. Caregiving is 24/7 job. I don't get to go home. They were okay for 3 years, and then their health went down. 2 days before my dad died, my brother was diagnosed with thyroid cancer. 10 months after my brother was diagnosed, I was diagnosed with the same type of thyroid cancer as he has. The registry helped me a lot. It's not only I who go through this. There are other people. Going into that registry, I feel very safe. I open up. There's a lot of things that I wanted to learn. You know, I click on from this point and say, oh, let me check that one. And then it went there, you know, and it's amazing that I have all those information for me. With photography, I can focus, meaning I don't have to think anything about caregiving or cancer. It's just a form of meditation for me. At this point, you know, it looks ordinary, but when I take it, there's something in it. Really. I entered this in Mike's camera contest about years ago, and I call it that there's beauty in darkness. Cancer is darkness, and yet there's beauty in it. So there is light within the dark. If I die today, I don't have any regrets. Caregiving, I found the purpose of my life. It's a question that I ask myself every day and said, how could I help somebody else? How could I help me? Even though we have cancer, we can enjoy our life.
So inspirational to us all. So if you haven't sent in your questions, you can start submitting your questions in the Q&A found on the bottom menu bar. Let me just check if there are any questions in the Q&A. Please bring your questions. And also, I just wanted to mention, if you missed out or would like to revisit this webinar, be on the lookout for an email from me at the MDS Foundation. You can also, please feel free to reach out to me, Audrey Hassan, at ahassan@mds-foundation.org for any questions. And we will also be providing you, if you missed out or would like to revisit this webinar, be on the lookout for an email that will provide you with the link for on-demand viewing. Just checking now to see again if we have any questions.
Yeah, can I just, Audrey, I put
Sure.
some things in the chat. I put 2 links to resources, free resources through Cancer Support Community. The first is a link to our helpline, which is a telephone number that is open many hours. I'm not going to remember them off the top of my head, but I think 9 to 5, if not more. And so please click that link if you need access to any kind of support or navigation. They're there to talk with you. And then the second link is some access to virtual materials that we have. Not knowing where our participants are from, this is a great place to access materials that we have there. And there's many more at cancersupportcommunity.org, as well as MDS Foundation has resources available as well. So please don't hesitate to check those out.
Thank you, Dr. Miller.
I just wanted to emphasize, as we saw in the last video, that the registry is open not only to the patients with MDS, but to their caregivers. And I think that's an area that we often in the clinic, neglect. I mean, a lot of our patients with MDS, they need help, from the caregiver driving back and forth for the transfusions, getting the treatments. And then when they leave the office, the caregiver has to be with them and has to be with them 24/7. So and we don't often pay attention to what are the needs of the caregiver in our clinic. This registry can help us learn a lot more about what the caregiver experiences. And so, if you're a caregiver and you haven't had an opportunity to voice your concerns, here's the opportunity. So I would say that this is a very unique thing, because we don't usually look at this area in a clinic. We don't really talk to the caregiver and really focus in on their needs. And here's the chance for those patients. And in MDS, as all of you know who have MDS, you lean on your caregivers a lot, and this is an area for an opportunity for them. So I would really like to say, as we saw in the last video, that young lady who helped her parents, this is big part of what the registry is about.
Thank you, Dr. Goldberg. Well said. It's so important to get the caregiver perspective, and it does affect the whole family unit. So well said. So it looks like we still don't have any questions in the Q&A. I'll give it another minute or so. But in the meantime, we may be able to give you back about 15 minutes of your day today. And again, please feel free to reach out to us and to me at the MDS Foundation. Again, my email is ahassan@mds-foundation.org. And again, I will be sending an email to all of our attendees with a link for on-demand viewing of this webinar that you can share with your friends and family. But I especially want to take the time right now to thank Drs. Miller, and thank you, Dr. Goldberg. I know that you have many other commitments and deadlines, so thank you for donating your time today, participating, and taking the time and effort that went into preparing for this webinar. And thank you everyone for attending. On behalf of the MDS Foundation and the cancer support community, I want to thank you all for joining us. This concludes today's program.
Thank you.
Thank you. Have a great day. Bye-bye.